Hello students, I welcome you to Proficient Learning. The topic chosen for today's discussion is disorders of acid-base balance. So, what is the normal pH of blood? Normal pH of blood is 7.35 to 7.45. Any pH that is above 7.45 is known as alkalosis, and any pH that is less than 7.35 is called acidosis. So the easiest way to remember would be alkalosis has got a K, which means kicking the pH up. Acidosis has got a D, which means sliding down the pH. Now, based on this, acidosis and alkalosis can be divided again into two based on the amount of bicarbonate and carbonic acid that is present in blood. So based on the amount of bicarbonate, if there is a decrease in the level of bicarbonate, then it is called metabolic acidosis. And if there is an increase in the levels of bicarbonate, it is called metabolic alkalosis. On the other hand, if there is an increase in the levels of carbonic acid, it is called respiratory acidosis. And if there is a decrease in the levels of carbonic acid, it is called respiratory alkalosis. Now, what are the different causes of metabolic acidosis and respiratory acidosis? So it has been beautifully explained in this diagram. We shall see a few. First, respiratory acidosis. So any condition that causes hypoventilation or decreases the rate and depth of respiration will cause respiratory acidosis. A few examples include chronic obstructive airway disease, chest trauma, neuromuscular disease, drug overdoses, etc. On the other hand, metabolic acidosis is a very important condition, and the most commonly seen condition is diabetic ketoacidosis, which arises due to uncontrolled diabetes mellitus. Along with that, other conditions like overdose of salicylate poisoning, diarrhea, renal failure, shock, etc. can cause metabolic acidosis. Going on to alkalosis, any condition that will cause hyperventilation or increase the rate of respiration will result in washout of carbon dioxide from the body, causing respiratory alkalosis. The commonest example is anxiety. Other examples include hypoxia, fever, pregnancy, high altitudes, etc. Whereas alkalosis can also be metabolic, and this is primarily due to overuse of antacids, loss of gastric juices, and very importantly, the effect of potassium wasting diuretics, which are used to maintain the blood pressure. Now, just to go through what we have seen, what is acidosis and what is alkalosis? Any pH that is less than 7.35 is called acidosis, and any pH that is above 7.45 is called alkalosis. So in such a condition, what does the body do? The body immediately activates mechanisms for compensation, and this compensation may be partial or it may be complete. Now, if the underlying problem is a metabolic disorder, then there will be respiratory compensation, which is brought about by hyperventilation or hypoventilation, or in other words, by increasing or decreasing the rate of respiration as and when required. Whereas if the problem is a respiratory problem, then the kidney or the renal system starts kicking in, and then metabolic changes will take place so as to bring around metabolic compensation. So this is a brief idea about the disorders of acid-base balance. Now we shall see a few questions based on this. So the first is, what is the normal pH of blood? As you can see, there are a variety of options that are given. The correct answer is option C, that is 7.35 to 7.45. Going on to the next question. Salicylate poisoning or overdose is most likely to cause which of the following acid-base disorders? Option A is metabolic alkalosis, option B is metabolic acidosis, then C and D, respiratory alkalosis and respiratory acidosis respectively. As you very well know, as we have seen, the correct answer is metabolic acidosis. The next sample question that I have chosen is, in a case of metabolic acidosis, what is the compensatory response? You can see 4 different options given, which can be an increase in the partial pressure of carbon dioxide, a decrease in the partial pressure of carbon dioxide, option C being a decrease in the bicarbonate levels, and option D being an increase in the bicarbonate levels. So since this is a case of metabolic acidosis, the respiratory component starts compensating for it, and the correct answer is decrease in the pressure of partial pressure of carbon dioxide, and that takes place by increasing the rate of respiration, thereby causing a washout of carbon dioxide. More details about these classes are available in the website. So please join us. And thank you so much for learning with Proficient. Have a nice day. Thank you.